Welcome back. This is Newsfile. It's your most authoritative news analysis platform. It's brought to you by Bank of Africa, strong as a group and close as a partner. MTN, everywhere you go. Ashesi University, educating ethical and entrepreneur leaders for Africa. Robert & Sons Optical Services, your comprehensive eye care service provider for 33 plus years. My Way Insurance. Dial *165# on MTN to join My Way today. Syntex Tanks. It's strong, it's tough. Activa International Insurance, our clients are passion. International Facilities Management Association is also delighted to be associated with Newsfile. Safari Valley Eco Park, bringing you closer to nature. And I say my favorite show and people ask me, but Newsfile is your favorite show. No, it's not. My favorite show happens on Sundays at 2 p.m. So tomorrow, join me on the law. 2 p.m. We're looking at the law and Singapore's global attraction. I'll be dealing with having conversations with the people that you see on your screen, Shem, Aloysius, and Kohei. All of them lawyers, formidable lawyers in Singapore, and they will have a great conversation. Because we are going there and seeking business from them, let's explore the discussion to understand how their situation is. But I can assure you one thing, the law works to the letter, especially if it's a corruption matter. They'll deal with it in seconds. It doesn't matter who is involved. So join me tomorrow at 2 p.m. to have that conversation. Now let's go to the Rich Hospital, where someone by name St. Williams went there to do whatever he had to do, and it ended up with an alleged assault of a nurse. And then the minister, Ralph St. Williams, and then the minister set up an investigative committee, and the committee did its work, brought its report. Now, just too many are questioning that report. But the report also has some revelations that will trouble you. That the whole Rich Hospital, the hospital that we say is an example of a good healthcare facility, does not have basic diagnostic machines. So people have to be asked to go look for the services elsewhere. Looks like that place is also beginning to turn to a place like Kolebu, where sometimes you go, the basic things you need are just not there. They are asking you to go out. And then on the road, Kolebu Road, you see all the, things you need are there. Dr. Anson.
Samson.
Where do you start from as far as this matter is concerned, even though we are very limited time?
Okay, so probably let's zoom into the findings, the conclusions. As for the narratives, we've all heard so much about them. I want to group the findings into two. The first is what you spoke about. So that will, if you look at the four key findings, I'll put number 1, number 3, and 4 together. Number 2 borders on the patient for now, or the victim. Now, if you look at number 1, it's basically telling us that there was no delay in attending to the patient. However, the systemic problems within the facility, which are outlined in 3 and 4, was basically the cause of a delay in getting a definitive diagnosis and treatment. And of course, this tells us that the actions of this gentleman, Ralph St. Williams, or whatever his name is, I'm not too familiar with the name, were unfounded, because the committee has established clearly that there was no delay. And if you listen to the narratives as evolved over time, the nurses or the medical team were clear in their minds that they had already treated him, and the other patient that he was complaining about had also been treated. But, of course, the systemic problems were what they were trying to deal with. And those ones are beyond the scope of the ordinary worker in the emergency room. Now, if you go to 3 and 4, where they talk about the lack of facilities or the broken down equipment and what have you, that begins to tell you the kind of challenges we have in our healthcare system. You know, Ridge Hospital is part of the Ghana Health Service. And arguably, it is their flagship health facility, arguably. So, if here in Accra, we see all these problems, you can imagine what happens in the regions and the districts. And then, of course, the sub-districts. We have situations where virtually all the diagnostic bits, as outlined in the reports, are all broken down. And the recommendation even goes on to tell us that beyond Ridge, there are other problems that we need to attend to in the overall chain. So, i.e., outside of the Greater Accra Hospital, which we popularly call the Ridge Hospital. Now, if the patients or the population do not really understand the dynamics of the health system, we'll have a situation where these inadequacies will always be visited as sins on the workers who happen to be there through no fault of theirs. They are trying to practice their lawfully chosen professions and to help all of us, because health is a common good for everybody. Unfortunately, these problems, I don't know what exactly our problems are as a country and why we get ourselves into some of these situations. The culture of maintenance, the culture of sticking to agreements between parties, because these diagnostic sets that are all not working, they are very more or less recent agreements on some of these things. So you ask yourself, how on earth is it possible for us not to ensure that the details of agreements we have with providers of some of these equipment are just, adhered to? How is it the case that we always want all our equipment to fall flat without any value for all of us? And then we continue to lose lives, we continue to have issues like we are all grappling with.
In 2023, is it June or July, as Dr. Kwame Sapong-Asiedu and Sechi Brown Reginald have brought to our attention, there was a hospital's assessment, report that was generated. And among the key findings were that only 38% of all facilities offering inpatient services have dedicated isolation beds. 74% of regional hospitals, 68% of district hospitals, and 36% of other general hospitals offering inpatient services had dedicated isolation beds. Overall, 32% of facilities have access to an emergency transport system for patients. The primary level had the least access to emergency transport systems. 18% of CHIPs and 29% of health centers, 39% of polyclinics and 40% of clinics and maternity homes. It gives you a litany of how retooling of the hospitals doesn't appear to be our priority. So the very basic things they need, they are not there. And here we were building 11 hospitals, and now we hear also the NDC talking about building some others. Meanwhile, those that are already in existence, they don't have the facilities.
That's the problem with that. The culture of maintenance is so bad, and it cuts across everything. Look, you check all the sectors that we have as a group of people, as a country, and you realize that any facility that is put up virtually lacks maintenance. And it's something that we need to work hard and move away from. You see, on this emergency bits, this is one crucial area where we've actually lost sight of same over a long period. I remember when I was active in, GMA activities, we've had times that we've dedicated a whole annual general conference or a public lecture to speak about things like emergency medicine. Emergency medicine is such that if you don't up your game, you're going to lose a lot of your citizens. Most health facilities don't have what you can describe as a functional or a proper emergency room. Human resource is also another challenge. If you look at this report, it tells you the staffing norms, where on the nurses front, you have a chunk of them having left posts, ostensibly to see greener pastures elsewhere. And I don't fault them at all. Let's be candid with ourselves. We don't manage the human resource properly. We don't treat them well. We don't pay them well. And when others dangle carrots before them, they will go. If you look at what the report said about the staffing norm and the numbers of doctors and nurses who are at post, as opposed to what should have been at post just about a year ago, you realize that they've lost a huge number of healthcare professionals. Meanwhile, the population also keeps getting bigger. So the limited numbers who are available now are overstretched, and people like this Ralph Saint, whatever, Williams or what it is, wouldn't understand the nitty-gritties of some of these problems. And we want to go there and assault people and behave anyhow towards health professionals.
What would be a quick comment before I move to Sule and to Rashid Tanko? What would be a quick comment about what the report said, that only verbal altercation confirmed on video, no evidence of physical assault, but the nurse, Miss Rejoice Bote, reported hand injury the next day. She was treated with pain relief, rest, and psychological support. No fractures and no dislocations.
Well, you see, they are conflicting accounts. Let's be honest with ourselves. This lady was on duty. So your duty runs throughout the night till the next morning. I don't know what point in time that this assessment was done. But clearly, from the day of the incident, the lady stayed in the hospital on admission. So I think last Wednesday, Thursday, that she went home, barely 2 days back. Obviously, having been in the hospital for that long, I also don't know the point at which this committee did these findings. But as the standard is, you come in, some initial assessments are done, reviews are done, investigations, imaging, all of it. So I don't know whether the committee had access to all the imaging and the subsequent reviews.
You have doubt about these findings.
What I'm saying is that the narrative, this lady stayed there for about 9 to 10 days. Under standard clinical practice, if somebody is on admission for about 9 to 10 days, obviously there is something wrong. Unless whatever she was on admission for is completely different from, in quote, the incident that happened. But from what we have come to understand, she's been there as a result of what happened. So the natural thing or the logical thing is that if somebody has gone through this and has been at the hospital for even more than 2 days, clearly there is something wrong. Because usually when somebody comes in, whether injuries, assault or whatever, we look at it and we may discharge you or we may keep you in.
So I get you. You wouldn't directly answer me and say you have doubts about this report.
Hold on.
But that's what you have done. You have impugned the report.
No, what I'm saying is that I don't know the point at which these panel members met the patient. But clearly, she hasn't been well and she's been around. And aside the initial bits that we all saw as a medical report, subsequent activities have been done. If you go through the medical records, I'm sure you will see all of them.
You have done that?
No. What I'm saying is that once you are on admission for this, every day we will review you twice the minimum. Okay. Beyond that, let's also make this distinction. Just a quick one. Let's also make this distinction clear. You know, the criminal investigations being handled by the CID should not be equated to this committee's work.
Of course.
And the police have actually sent somebody to court with some level of evidence. So clearly there could be more to it than is contained in this report.
Well, Samson, I've taken a look at the report, and I think for me, two things. It appears that the report seemed to place a lot of emphasis on the degree of injury or the level of assault or whether the person was wounded or otherwise. And I think that, for me, is not the point. If for example, she was slapped and you do an X-ray and there is nothing that has happened to the jawbone and so on and so forth, would you say, oh, that was something trivial, or we checked and it didn't have any impact on her or something like that?
In fact, in law, assault is not only when there has been actual battery harm, like beating of the person.
And exactly that is why the lady is actually in court. The thought aspect of the assault.
Right.
Yes. So for me, I think that aspect of the report is a bit problematic. But the other side of interest to me is the revelations in terms of the state of the hospital. Where you have a regional hospital, not refurbished long ago.
Celebrated regional hospital, just recently refurbished.
Yes, and then we are told that the emergency section is always busy, always almost full to capacity. But this is a hospital with no X-ray functioning, no CT scan functioning, no MRI functioning. So that, for me, is a disaster. A regional facility that people will look up to, and that is the reason why the emergency department is always full to capacity. And these fundamental diagnostics equipment are non-functional. Then how is it a hospital, really? How is it better than the clinic at the village, beyond having some specialists here because it's a big facility and all of that? I think that is where we should really pay attention to. And it really emphasizes the point about the situation in the 5 regions of the North, for example, where at one point, none of the facilities in the whole of the 5 regions had a functioning MRI. And I think, Honorable...
They had to bring somebody recently to Techiman.
To Techiman.
To do, MRI, to do CT scan.
But you see, Honorable, that is why sometimes when some of us are reviewing the amount of waste and loot in the system, it gets depressing. In fact, the other day I was telling my colleagues who are on our 4th estate project that, well, we have to have regular mental sort of therapy for them. But because some of the things, when you see something, you wonder, why should we be doing this out to ourselves?
They're under pressure.
Some of the contracts and the payments that are made. And because Honorable is here, transport.
You mentioned my ministry.
Yes, you were there, 2022.
What about my
you
ministry?
pay what? 95.9 million Ghana cedis for airport disinfection. Which airports?
Which year?
2022.
Okay, so let's not divert. We don't have time.
So
let's not divert the
it's quite
discussion to something else.
when you see our hospitals, our sick hospitals being the ones.
Kwame Sapon-Asiedu actually summarizes a part of the Harmonized Health Facility Assessment report that I referred to, released in July of 2023. And he says nothing in what we have seen now surprises him. He says overall, availability of medical imaging equipment and services is limited. 27% for ultrasound and 6% for X-ray. High-end modalities for specialized diagnostic imaging procedures are lacking, with less than 20% of regional hospitals offering mammogram, CT scan, MRI, and fluoroscopy services. With regards to gastrointestinal endoscopy, colonoscopy was available in 12% of regional hospitals.
So we have sick hospitals, and I think that before we even talk about treatment,
sick hospitals,
we should treat the hospitals first. Otherwise, we basically would be harming people by taking them here, to these places. But our doctors can basically advise in terms of their expertise. That we need to do this, you need to do that. So I think we should treat our sick hospitals as a matter of priority.
Thank you. Rashid.
Well, for us, we as a government, we are not surprised. We inherited a very terrible infrastructure from the NPP. I mean, this propaganda of 111, Agenda 111 was just a fluke. It was a complete fluke. just went to a complete fluke. I mean, what did
No, but Tanko, let me ask you. If you have a situation where about 88 districts don't have hospitals, don't you think they deserve hospitals?
Okay. If you have 88, you go and be talking about agenda 1111.
No.
The existing ones that he's talking about.
Our time is up.
I'm sorry. Council, let me handle this. You see this. We have to thank the Honorable Minister. He has shown leadership in this Rich Hospital matter. I mean, he did very well, Honorable Akando. The way he managed to douse the tension over there, try to resolve the issue by getting through this committee to come out with this recommendation. I read the recommendations and then what they intend doing. Government will take it up seriously. I mean, it is not our intention as a government to allow medical doctors to be subjected to this kind of thing. Government will make sure that everything is done. We'll have a conducive environment and we'll fix the problems that you just identified. His Excellency John Dramani Mahama, if you look at his statement, when he was sworn in, he made a categorical statement about health facilities. And that is why we brought in this Mama Care. You see, you are saying, you people created it.
The truth of the matter is that the elephant in the room, really, is the fact that there is an attempt to protect the person who was the perpetrator. He brought out all of these things, one Ralston Williams. He is the one that, look, in all these hospitals, sometimes you go there and you have to wait. Sometimes, you know, the workers are working under severe pressure, lack of equipment, and so on and so forth, psychological, personal issues, and so on and so forth. You don't go there assaulting nurses. And in the report, you can see there is a clear attempt to shield him away from all liability that he's supposed to face. And they are saying that there was no evidence of assault and so on. Look, in law, and there's a celebrated case of Cole and Turner, they said that the least touch of another in anger is battery. So you don't need to even hit me so hard to dislocate my jaw or something. The least touch of the person in anger, well, you put a certain fear in the person already. So the person doesn't have to feel physical harm, but even mental or psychological harm. It's enough, you know, to ground an action. But you see, the point that you make about the hospitals, I'm surprised. I'm surprised that you don't find anything wrong with government putting up hospitals. That is very,
we're saying, but
I'm scared for this country that you don't see the need to complete the hospitals. Some of them have been completed. It's just left with operationalization. You have to operationalize them.
And for some of us, our surprise is how this assault case has become an NBC MPP banter. The Ralph St. Williams, is he an NDC guy?
He is. They're shooting him.
Oh, I see.
He did the same thing to Honorable
thank you.
in Parliament. The next thing that will happen,
Thank you, Hassan. Thank you very much. Thank you very much. Now, as we end, Dr. Eduardo says that there are instances where some people at the hospital sabotage smooth delivery of labs, scan services, and other equipment and reagents in order to drive patients to private hospitals they have interest in. I think such machinery and sensitive equipment, even if purchased by government, should be given to private entities to manage in a PPP agreement, since such private entities will not allow such routine sabotage and lack of proper care and maintenance. And then we'll walk out on this note where Enchibu Esiako says that sometimes we have to call a spade a spade. Let's tell the NPP and NDC to be ashamed of themselves. They are the reason the state is wasting police and other resources on one by-election. Both parties have failed to behave with maturity. They have failed Ghana for over 30 years and are not ashamed to continue this way. If they know shame, they should have walked out of your studios in tears after listening to your take on Singapore.
He's the one in government.
Thank you very much. My guests have been Hassan Saleh.